Nora, non-operating room anesthesia. Nora is an administration of sedation and or anesthesia or monitored anesthesia care to patients undergoing painful procedures or uncomfortable procedure or diagnostic procedure at locations outside the operation theater. These remote locations include, which is outside the operation theater, they include radiology suites like MRI, CT scan, and interventional radiology, gastroenterology endoscopic suites, cardiology cath lab, ECT center, IVF center, renal center for lithotripsy, dental center, labor room, and burn center. Patient profile for Nora. The patient requiring anesthesia at Nora remote locations are children, especially because they are uncooperative, infants or neonates, claustrophobic patients, especially during MRA, patients with trauma who cannot lie in particular position for a longer time during radiological investigation like MRA, patient requiring painful procedures, so patient requiring like burn dressings, labor analgesia, and patient requiring ECT. The aims and goals of anesthesia at remote location is patient safety and safe conductive anesthesia are two most important goals of anesthesia at remote location. The standard of anesthesia care and the monitoring, it should be same as the suits would patient safety, relieve anxiety of the patient, minimize psychological trauma, provide amnesia, minimize the pain and discomfort of the patient during the procedure, maintain the patient vitals and physiology. There should be complete recovery from the sedation and anesthesia before discharging the patient from remote anesthesia location. The challenges of Nora, it can be classified into groups. So based on groups, we'll discuss each challenges. So based on location first, uh, the location, mostly it will be far off from the pharmacy and the main supply stores. The environment may be noisy as an MRI, and it would be a small procedure rooms with a very limited workplace, inadequate lighting and temperature regulation. Electrical or magnetic field interference would be there in fields like in suits like MRI. Next is equipment related challenges. Equipment at remote locations outside the OT are generally old and outdated, especially anesthesia machines. There would be inadequate monitoring devices, inadequate improper oxygen supply, inadequate resuscitation equipment, and difficult airway management equipment. So this all makes the anesthesia outside operating room very challenging. Staff related challenges are medical staff working at the remote areas are only trained in their subspecialty, and they are not well versed and trained with anesthesia equipment, and thus not very helpful in conduct of safe anesthesia and during any AVI and anesthesia related emergency. So planning is very important before starting a case, and anticipate the problems and take necessary action before starting the case, as communication with main theater is difficult during the case, and it may take time for the help to come. Procedure related challenges with Nora are most of the endoscopic cardiac catheterization and interventional radiology procedure. They require video streaming and it's also done in dark rooms. So illuminate poor in procedure room. Next, post anesthesia monitoring facilities are lacked at remote anesthesia locations. The procedures are done off duty hours, and it thus making difficult for call for help at these locations in case of unanticipated airway emergencies. Iodinated dye used for contrast in interventional radiology or cardiac cath labs can cause anaphylaxis. So anaphylaxis tray with all the drug to manage anaphylaxis should be available. Radiation exposure in interventional and cardiac cath labs is very high. So, anesthesiologists and anesthesia supporting staff should be aware of these hazards and take necessary precaution to avoid radiation exposure. Um, Sometimes the anesthesiologist may be called in between the procedure when patient develops some complication in between. So there would be no time to assess the patient properly, and there are high chances of complications airway-related complication. Coming to patient-related challenges, most of the patient are admitted as daycare cases or an OPD basis. So careful pre-anesthesia assessment is necessary and it is must. Comorbidities, drug history, and fasting status must be noted before starting anesthesia for any case, and quick airway assessment must be done. Minimum requirement of facilities at non-operating room location for giving anesthesia is reliable oxygen source with backup facility, anesthesia machine which might be MRI compatible if at MRI suite, suction, standard monitoring facilities which is also MRI compatible, adequate lighting, and trained staff to support the anesthesiologist. Then part with all emergency equipment, drugs, and the defibrillator, airway emergency equipment, reliable source of communication to call for help, post anesthesia procedure care unit with all minimal required monitoring facility. Coming to the choice of anesthesia techniques for Nora, it would be monitored anesthesia care, sedation or conscious sedation, regional anesthesia, TIVA, or general anesthesia. Monitoring during Nora is standard monitoring, which includes heart rate, ECG, SpO2, non-invasive BP monitoring, and ETCO2. Post-procedure care, patient should be monitored till full recovery in post-procedure care at remote facilities, and if required, he or she might be shifted to the post-operative care unit. Patient ventilation after procedure should be shifted to the ICU by the anesthesiologist himself. The discharge criteria it includes in these patients, discharge criteria will remain the same as in any other patient after surgery or daycare procedure. That's it.
So this is the question that is asked with to be written. I hope so we have covered most of the points.